Okay, so this is my IV piggyback video. So I'm going to start by stating the 6 rights. So I'm going to make sure I have the right patient, right medication, right dose, right route, right time, right documentation. Start by doing my hand hygiene. I'm going to check the MAR to see what I need to have ordered. And IV needed has chlorophane 560 milligrams IV piggyback every 8 hours and 50 mils of 0.9 saline over 45 minutes. And he needs 4 doses. So what I'll do is I'll make sure that I have the right medication, that the dose is appropriate for his age and weight. And then I'm going to check my solution here. So I went to the med room, got my supplies, I have my solution, my tubing, my medication. So I'm going to open my tubing, or my saline here. So I'm going to check the expiration, the correct solution, the right amount, and make sure that it has no particulates, color, it's not expired. Alright, we're set to go. And for the amount needed, 560 milligrams. Yeah, we have that. So I'm going to clean my hands again. And this is going to be in the patient's room. I'm going to have, where's my seat? I'm going to clean the top of my container here. And I have my needle that I'm going to use to drop my medication. Okay. Put that in there. Make sure there's no air bubbles. And then again, using septic technique, make sure that the medication gets put into the port, into the medication port. Make sure you don't puncture the bag when I insert the needle. There we go. I can actually. And then I will mix this by rocking it back and forth. It should still be on there. I wouldn't have done that. So I'm going to do my hands hygiene again. I'm going to make sure I have the correct tubing, and it's secondary, and it's 10 drops per minute. So when I'm calculating my jerk factor, it's supposed to be over 45 minutes, and so this will be 12 drops per minute, and so that's approximately 3 drops every 15 seconds. Tubing ready. I make sure that my tubing's intact. There's nothing wrong with it. Okay. And so I can actually use this. I want my primary infusion to be lower than my piggyback. So I'm going to hand it like that. Okay, and so this is where I need to make sure I pull this off. Make sure I don't touch the spike. I'm going to spike the bag. And then make sure my clamp is done. There we go. Fill it half full. There we go. And then what I can do is make sure I get all my medication through. Okay. And then I'm going to start by hanging this. So again, this has to be higher than my primary infusion set. Okay, so again, have gloves. What I'm going to do is I'm going to clean the top port closest to the primary infusion. I'll attach it. And again, adjusting the primary tubing, or the main infusion drip factor according to the patient or the doctor's orders. And so again, this is going to be at, what is it, 3 drops every 15 seconds. So all right. Have the correct drip rate, and I'll make sure that my medication is this before I hung it, that I labeled it with the patient's name, the room number, the drug that I put on, the amount, and what was added to it, the base solution, my initials, the date, the time that it started. And so this started at 0800 and it's supposed to flow for 45 minutes and it's at a flow rate, yeah. And then the expiration date of when it would be. So I labeled it, and then yeah, so I got that hooked. Next, I'll just document any pertinent data that I needed to have about the medication. That's it.